if you look at mesothelioma, I've always talked about this, there's basically two diseases. There's an epithelioid mesothelioma and a sarcomatoid, and they act pretty much completely different, and we treat them differently.
All of us probably came up with our techniques in isolation. We may be doing the same thing, I have no idea, but we all came out of our training knowing how to do extrapleural pneumonectomies, which is the standard operation for this, and everyone who sort of migrated toward trying to spare the lung really, I think, comes up with their own technique. So what I'll be showing you is the way that we do it in combination with the photodynamic therapy.
When you look at the group that actually had induction chemotherapy, and this was done from similar programs from a sarcoma, and actually part of it was done because I had seen a sarcoma patient that looked very much like a mesothelioma patient, and had gotten sarcoma treatment, and his tumor almost completely went away even from the pleura. So we tried to treat the meso patients in a similar fashion.
We and some of our other colleagues that are here in the audience are opening a clinical trial that is a randomized double-blind study that is going to compare tremelimumab to placebo in second or third line treatment in patients with mesothelioma.
So helical thermotherapy is a novel technique that allows the delivery of image-guided intensity-modulated radiotherapy.
So what we've been using to model human solid tumors in vitro are three-dimensional multicellular tumor spheroids. This is also known as organotypic cultures, which offer an intermediary approach for modeling the three-dimensional complexities of primary human tumors, but outside of a living organism.
As a pathologist, and now as for a long time cancer researcher, one of my always thoughts has been is to help cancer research go faster. You need to take and make sure patients' precious cancer samples make it into the hands of many researchers, and that's what an MVB does.
So basically today I'll talk about a little bit about why we're doing the research, the development of this system. I'll present some problems in our hypothesis for the research. I'll talk about our novel cryotherapy system development phases. I'll show you some of the simulations that we completed in initial tests, and also our future directions for the system development.
Now the idea is that, Raja Flores and others and Joe have mentioned is that we can remove everything that you can see. Obviously there's microscopic disease in the vast majority of patients that are still left diffusely. So the question is, how do you extend your surgical margins another millimeter or two to incorporate most of those cells that are still sitting at the edge? So this is an idea where we found out from just doing some studies that we didn't even suspect to begin with that freezing cells was the most effective way to kill these cells. That's a non-targeted thing. It's just very non-targeted therapy. So, but when you go into the chest after you've done surgery, and if you were to freeze the entire surface that you've just opened up, you would extend your surgical margin that much farther.
Our coordinated research program is something that is really important because it differentiates us from other nonprofits. Many nonprofits give out seed money over a couple of years. Very often, if the researcher runs out of money, the research finds itself back on the shelf. This is not going to happen at PHLBI.
The interest in mesothelioma is steadily increasing, and more information is becoming available on the internet. Now, the key is to know how to sift through all of the websites, their sponsored ads, inaccurate or biased information, and find the truth.
I will tell you, for the patients here now, I want you to feel optimistic and strong with the decisions you've made, because so much care has changed in 10 years. Alan chose to have an EPP. He wanted the cancer out. And at that time, that's what we elected to do. But looking back, I actually wish that we would have known more, and treatment would have been more progressive then, and we would have taken those 6-second opinions and gone with Dr. Cameron.
And I've carried it through my whole life up until now. Like I said, 75 years old. And I am a cancer survivor. All the treatments I had so far, and I'll talk about those as I go through, or I'll mention them anyways, they've all come up pretty much negative. The first PET scan showed that they couldn't find anything either. And I remember the night of surgery, Dr. Cameron told my family that he thought he got it all. So the advice I have to mesothelioma patients, you must stay positive. Do not give up. I don't care what anybody tells you, do not give up.